Hello everyone, and thank you to my colleagues for their other presentations today. My name's Nicola and I'm one of the speech and language therapists working across Hampshire and Isle of Wight Healthcare. I'm based in Fareham and Gosport and I collaborated on this presentation with my colleague Danny Treacher over in Southampton. Sorry we can't be there in person today to present to you and meet you all, but hopefully this video will provide an introduction to speech and language therapy and how we might be able to support someone with FND. So first of all, it's really important to say that not everyone with FND will have changes to their speech, swallowing or communication. You might not experience any of the things that I'm going to talk about today, or you might experience one or two. But for the purposes of this presentation, I'm going to talk generally about some of the changes that can occur with FND. So someone with FND may notice a change in the way they communicate. So for example, they might notice a change in their ability to understand language or to express themselves. They might notice some changes in their ability to read or to write. Speech changes can occur, such as someone might start stammering. They might notice changes to their accent, to their tone, to the clarity of their speech or to their articulation. You can also experience voice changes, so you might experience a loss of voice or changes to the quality of your voice, or experience vocal fatigue where your voice gets tired with use. Someone might also notice a change to their ability to swallow, which can impact on their nutrition because they're not able to eat and drink as much as they normally would. They can start to lose weight, and obviously this can affect their enjoyment of food and how much they want to be able to go out and eat socially. So these changes can occur with other FND symptoms that I've already presented to you. So, for example, the cognitive changes that occupational therapy might have talked about, changes to concentration, memory and fatigue. But as I said, it's important to remember you might not experience any of these at all, or you might experience, one or two. So a lot of the strategies already mentioned by other professionals might also be of benefit to any speech or swallowing changes that you've experienced. And it's really important to consider what you can try to do to help yourself. So for example, finding more about FND and what resources are available to you. I think we'll be sending out a resources pack to you all after the presentations today, so please do have a look through that because there's lots of really helpful links and advice on there. Some people find it helpful to join online networks. They might want to speak to others who have an experience of FND to learn from others about what has helped them and to share their own experiences if that's something that they want to do, or if that's something that might appeal to you. As the occupational therapists have already said, managing levels of fatigue is really important. None of us function well at all when we're tired. So in order to give our brains and our bodies the best chance of being able to communicate as we want to or eat and drink as we want to, it's really important that you get plenty of sleep and plenty of rest. So for example, if you know you're meeting up with friends in the afternoon, or you're going to be doing a lot of talking in the afternoon one day, then it's really important to plan for a rest before and afterwards to ensure that you've got some downtime before and after. Think about what distraction activities could help you. So for example, one lady that I've been working with who has had a stutter, she's found that tapping her hand on her lap while she's talking, along with the syllables that she's saying, that can really help sort of distract her, and that has actually resulted in her being able to speak more fluently and to reduce the number of stammering behaviours that she experiences. You could also try using sort of simple hand gestures or simple signs to support your speech as well. Some people again find using their hands a lot more. That can help supplement their speech and can be a distraction that then enables them to get their words out a lot easier. It's important to consider any relaxation techniques that might work for you, such as mindfulness. Diaphragmatic breathing can be really important, taking those really deep breaths down into your diaphragm. That can be really relaxing and can be really helpful to consider grounding techniques as well. So there's lots of different relaxation techniques out there. guides available online as well to kind of talk you through, and it might be that you try one or two of these first until you find a strategy that meets you, that works for you. So when preparing for this presentation, I asked a client of mine for some feedback on things that she wished she'd known at the start of her journey with FND, and this is what she told me. She came to me with a stutter and word finding difficulties, but I think her advice could be relevant to anyone with FND. So she talked about the importance of, when it comes to communicating with FND, people can understand you a lot more than you think. Communication isn't just about words, it's about body language and expression. So she talked a lot about using her hands and using her facial expressions as well to help her communicate. And she said, when you're having an issue communicating, try to be kind to yourself. Pause and try to find a different route if your current one feels blocked. So she talked about trying to find ways around the blockage that she was experiencing in her communication. She also talked about experimenting with different things and about learning what worked best for her or for you. You're a lot more adaptable than you think you are. And I think this last point that she makes is really important. You know, trial and error is really important. Everyone's an individual. We don't know what's going to work for one person, might not work for another, and vice versa. And you're the expert in yourself, and you know what you're capable of achieving much more so than any healthcare professional. So you know what your strengths are and what you enjoy doing. So it's about finding out your own individual ways to help manage your symptoms. She also identifies another important point which helped her, which was telling others what help she wanted or how she wanted them to respond when she was stuttering. Often people didn't know what to do, and she could see that in their reactions. So they would look at her a little bit strangely. She sort of said they would narrow their eyes a little bit, and that made her more anxious, and then that resulted in her stuttering behaviours more. So that sort of cycle would get worse. So she found it helpful to be assertive and say to people right up front what help she wanted, and that then enabled her to communicate more effectively. So she says, try not to bottle things up by yourself. It's good to let other people know if there's anything that you'd like them to do to help you. She also found this helpful because some people sometimes try to finish off her sentences for her, and she found that really frustrating. So she wanted to tell them right from the start what help she wanted. So in her case, if she stammered, she just wanted people to stay quiet and wait for her to finish. And occasionally she would ask for specific help with a word that she couldn't get out. And she would often use humour as well. So she would laugh and giggle with her family if something came out wonky, as she described it. And so she said there's no right or wrong way of being. It's just about finding out what works for you and what you feel comfortable with. So she said, as long as it's something that makes you feel positive, more positive and comfortable. And when you're around good people, good supportive people, and you're being kind to yourself, it can really make a lot of difference. So if these self-help strategies don't appear to be effective and you feel that you might benefit from a specialist speech and language therapy assessment, then you can get referred to our service. So we will then assess and diagnose any speech, language or swallowing changes, and we'll help you to identify whether now is the right time for you. So we've talked about other professionals being involved. You've heard from other professionals here today, and we might need to consider whether actually now is the right time for you, or whether we need to prioritise another therapy first, or whether is it best to sort of work alongside each other. We would then look to facilitate goal planning with you, and like the occupational therapists have mentioned, therapy is much more likely to be effective if you come to therapy having a good understanding of FND, you kind of agree with that as the diagnosis for yourself, and that you're motivated to make positive changes. We can help with goal planning and thinking about what you might want to work towards, but it's really important that you've got an idea or a focus of what you would like to achieve as well. We would then sort of come up with a treatment plan and also work towards the self-management strategies that we've already mentioned as well. As I said, working with other healthcare professionals that you might be currently working with as well, planning for the future and making any onward referrals as needed. So if we do recommend any direct therapy, it might involve building on some of the self-help strategies that we've already mentioned, but we might also look at some of these mentioned here. So it could be about looking how to overcome any learnt patterns regarding your communication or your swallowing, and trying to regain control over those. Experimenting with how to extend that control back into everyday activities. We might also consider doing any mirror work or video playback. I've had quite a lot of success with people looking at videos of themselves, sort of identifying what's going on for them, playing it back, and then using that information to think about how they can try and do things differently. Obviously, we'd grade tasks in terms of their level of difficulty, starting off with an easier task, that it's something that's going to be achievable, and then taking those gradual steps, like up that ladder there, to help you achieve sort of harder tasks. It might involve some positive reframing, so looking at how you can think about situations or challenges differently, so that you can approach them with a different frame of mind, but also looking at strategies to deal with any relapses that may occur. Different approaches might suit different people. Everyone's an individual, and it will be very much led by the individual client, working in collaboration with a therapist to agree what's the best approach for them. So just to share with you here a client's journey, and she came to us with a swallowing difficulty. She'd been referred by the dietitian because she had lost a lot of weight because she was only eating pureed foods. She identified a goal as wanting to return to eat scampi with tartar sauce, which was her favourite there, and you can see that depicted in the image, which is sort of making my mouth water here as I'm talking to you. She had several disordered swallowing symptoms. So, for example, she always would suck her cheeks in when she was eating, and obviously this made the chewing action a lot harder, made it a lot harder to then try and chew the food up properly to then be able to swallow it. So treatment for her focused on sort of retraining the motor patterns for swallowing, so retraining her to understand what was a normal swallow again, retraining those muscles to remember what it was like to swallow without those disordered behaviours, challenging the unhelpful thoughts that she had in relation to her swallow, identifying what the triggers were. So was there anything that was triggering those particular disordered swallowing behaviours, and trying to identify those, to become more aware of them, to kind of prevent that cycle from being triggered. And then also planning for setback and any difficult situations that she might see in the future. Her goals were achieved after 3 months, which was just brilliant. So I just want to close this presentation now by thinking about a take-home message from the communication client that I talked to you about earlier. I think it can apply to anyone with FND though. She says, where you are right now with your communication is not where you're going to stay forever. You're going to have good days and bad days, and you can choose to focus on what you can control, which is how you react to the obstacles in front of you. And she talked a lot about FND symptoms taking control of her, over her, but once she realised that she could change how she reacted to the symptoms that she was experiencing, she felt like she was taking some of that control back, and this really helped her to manage her symptoms. So I hope that might help you to start thinking differently about your own symptoms too. Thank you for your time today, and I'll pass you back to the others in the group. Thank you. Bye bye.